Nigeria's healthcare sector is beset by several challenges, like every developing country. Shortage of healthcare professionals, lack of essential medical supplies, neglect and underfunding are just some of the issues hindering effective healthcare. Power supply is also another one. Some might even say this is the biggest one. At a stakeholders dialogue on power in health sector, the federal government has pledged to significantly improve electricity supply across Nigeria's health facilities, setting a target of 50% improvement by 2027. President Bola Tinubu has also said his administration will no longer tolerate persistent power outages in hospitals. Minister of State for Health and Social Welfare, Dr. Iziaq Salako, says he's ready for a shift from policy discussions to concrete action.
Health systems are not only underpowered, they are not efficiently powered. A survey that was conducted by the Sustainable Energy for All in 2021 showed that 40% of the functional PHC facilities in Nigeria do not have access to electricity, with the majority of the remaining 60% receiving not more than 10 hours of power daily from various sources.
By powering healthcare, we are advancing both priorities at once. It's like using one stone to kill two birds.
In our health system, which has underperformed relative to many other countries, in the last 2 years, we've seen the solutions transforming it day by day, from the way it's governed, to the infrastructure in the primary healthcare system, to the equipment, to the financing.
This initiative to advance energy solutions in our hospitals is not an isolated intervention. It is an integral part of the strategic direction of the Renewed Hope agenda to address energy poverty.
Well, joining me now in the studio is the Minister of State for Health and Social Welfare, Dr. Iziaq Salako. Glad to have you in the studio to discuss this
Thank you very much.
Yeah, interesting discussions, all right. But so we'll tell you, lights out, lives lost, the human cost of capital, hospital blackouts of maternal health. What actionable efforts is government making to aggressively change this narrative?
Thank you very much, and good evening, Nigerians. I think that starting from the convening of that first stakeholders dialogue is a recognition of it is a problem, and it's also a commitment to do something about it. And if you have followed that dialogue, you will see that for the first time we're able to pull not just the Ministry of Power, the agencies of the Ministry of Power, Rural Electrification Agency, Electric Council of Nigeria, NEMSA, all of them. We're also able to pull the agencies of finance, the Budget Office, we're able to pull them, ICRC, that is in charge of privatization, we're able to pull them, and we also have significant participation of the private sector, including our partners. So that means that we recognize the problem and we're prepared to take action. And like I said in the course of that dialogue, we recognize there are quite a number of challenges in the sector. But what we have decided is to do accurate diagnosis starting from there. And that stakeholders dialogue is a means of getting accurate diagnosis of the challenge of power in the health sector. So we have done the diagnosis, and we know where the gaps are, we know where the issues are, and we have now come together, do a compact that is a commitment by all the stakeholders to move the needle.
And that's the, are you still on?
Yes, please go on.
Okay, now let's discuss, that recently signed compact that you say will achieve 50% improvements in electricity supply to Nigerian health facilities by 2027, which is a little bit 2 years from now. So how will this, according to you, these are your words, mark a shift from rhetoric, talk is easy, to action?
The fact of the matter is that there are solutions that are available. It is creating the right policy environment, knowing the right set of people to talk to, building the local capacities, and amplifying commitment that is needed. For an example, we know that solar in Nigeria, sunshine is a free gift.
Free.
That virtually every part of this country enjoys some reasonable level of sunshine. And the development of science has also helped us to be able to harness sunshine energy to produce electricity. And that has really also developed over the years. So we're looking a lot towards how do we better utilize solar to power some of our facilities. And of course, the immediate question that we'll ask, that will come is, how do we finance it? Because that is usually the limiting factor. And we believe that by creating that right policy environment, since I became Minister of State, for example, I can tell you that I've received not less than 5 or 6 proposals of people who come forward and say, look, we want to go and do a mini solar grid in your hospital. We want a guarantee that you take the power and then over time you pay. But we do not have that right policy environment to properly manage that, to ensure that it is the best advantage of the ordinary Nigerian. And that this dialogue has helped us to be able to pivot in that direction. And that is one area that we're going to use. So we're going to use a lot of solar energy, blended financing mechanisms, grants mechanism, even budgetary funding to be able to push that. And I think that what we have done is to bring more focus around that problem. I can tell you that between yesterday and today, I've received one very interesting proposal in the office that I'm sending out for the technical people to look at. Okay. So we think that what we have done is to bring it to the fore, and a lot of people have paid attention to it.
It's interesting that you're talking about what alternative source of, alternative cost of sourcing power. That's basically what you're talking about. They say when the preferable isn't available, the available becomes preferable. Yeah. So the issue of exorbitant cost of sourcing alternative power and the negative impact it has on patients and mortality rate as well. Doctors are lamenting. How is government trying to get around this? Because, okay, if you want to have alternative power, you still have the problem of cost.
Well, the fact of the matter is that there's no energy project that is cheap. Whether thermal, whether hydro, it is expensive. There's none. And with solar, the advantage is that, yes, the initial cost is expensive, but there's very little ongoing costs, which is a major advantage around solar. You know, of course, we also know that Nigeria being a gas country is another area that we must also focus at, you know, CNG-powered generators and also using gas to power energy in a captive manner in some of our institutions. So we just have to face the reality that it's expensive, and when we must look for the fund. And fact of the matter, let me tell you, I know I have one hospital that spends on the average of about 150 million every month.
That's huge.
150. In fact, one of the CMD came to me yesterday. I don't want to mention the name. She said, look, please put me on #1 in this initiative because I spend close to 200 million every month to power my hospital. So you can imagine if we can properly structure it, and somebody said, okay, I'll give you a 5 billion project, and then you pay me that 200 million every month, and then maybe in 5 years you finish paying, and then you own it. First, the efficiency is there because now it's 24/7. With that 200 million, you still have downtimes, you know. So that's the kind of thing that we're really looking at. And we think that with the support of a cross stakeholders, we should be able to
yeah, that brings me to, excuse me, the fact that you have instructed medical doctors to explore various public-private partnerships, that is PPPs, models to attract private sector investment. How far has this gone?
Well, it's ongoing. One very beautiful thing that we have been able to achieve is that Mr. President has actually approved the upward review of what can be done at facility level. Prior to now, I think maybe anything above 20 million, I'm not sure, has to come to the ministry. But now, in neighborhood of billions can be done at facility level. That costs very significantly the time that you need to start and consummate agreement. The RCRC DG was at the stakeholders' engagement. And one of the things that came out, it told us that at the maximum, within 21 days, proposals for PPP will be approved. And that is helping a lot. Our hospitals are now doing PPP in drugs procurement, using PPP in managing their laboratory, using PPP in their catering, for catering services, using PPP for security services, and so on and so forth. So we have a lot of penetration of participation of the private sector now happening within the health sector.
When you say that an implementation committee has been set up to look into a comprehensive strategy to tackle power shortages, what has come of that committee?
Well, the one major milestone that the committee has delivered is this dialogue.
Okay, the stakeholders dialogue.
The community delivered that dialogue, and they were able to put together that compact that was signed, because we needed to have a deep understanding, a clear understanding, like I said, accurate diagnosis of the problem. And when the proposal to do a dialogue came forward, it was something that I felt that, yes, this is going to be very, very useful, so that everybody is involved and we have an accurate diagnosis of the problem, and from there we can start moving forward.
What about the $1 billion concessional financing and grants you said has been secured to support the ongoing transformation of the health sector? How actionable is this towards saving
Actually,
lives?
there are a lot of concessional grants that we have obtained, but that one is particularly to drive the unlocking the value chain agenda that we have. We're also pushing. That is, if you are able to come forward with a bankable proposal, you make a good business case. The PVAC office, that is the Presidential Initiative of Unlocking the Healthcare Value Chain, can actually help you to secure facility through this grant that have been obtained. And I don't sit on that office, but I know that that is also something that is going on very well. And you will see that quite a number of companies are now coming into Nigeria. Now we have an RDT manufacturing entity right here in Nigeria, rapid diagnostic test, which started only a few months ago. We now have a movement to start manufacturing insecticide-treated nets locally. We now have a movement to start assembling diagnostics like ultrasound scan locally, and so on and so forth. So this unlocking the healthcare value chain is driving attention to the market, because Nigeria has the market. As a matter of fact, if you invest in Nigeria, if other countries patronize you, fine, but with 200 million, 250 million, that's a huge market. That is probably enough even for any businessman to be able to make the kind of margin that he needs.
Yeah, but private, excuse me, private hospitals, they feel so sad that times they want to, that's what they're there for. They want to treat patients, some die because of light and all that. And then sometimes they move them to the public-owned hospitals. Now, government-owned hospitals, they say, are not helping matters. When private hospitals refer severe cases to the teaching and general hospitals because of exorbitant power cost, the long queues defeat the purpose. Sometimes some die while on the waiting list. What are you doing about this?
Well, I acknowledge that we have issues of long queues. Of course, we are going to, first is to also establish that all the problems cannot be solved in one fell swoop. You must recognize that. But in order to address some of these challenges, the use of technology is also being emphasized. For example, emphasizing teleconsultation, and emphasizing training for our frontline health workers. We also, tele-prescription is also being encouraged. But of course, we realize that all of this rests on power. If you put digital health, if there is no power, there's nothing you can do. So quite a number of the things we have to do rest on power. So we must solve the power problem. And we believe strongly that if you solve the power problem, it will significantly enhance quality of care.
And the power problem is quite a major one because, for example, WHO reported that a woman in Nigeria faces 1 in 19 lifetime risk of dying during pregnancy, childbirth, or postpartum, compared to 1 in 4,900 in most developed countries, and this is most due to electricity failure. This is alarmingly poor.
Well, that is the reality, but we recognize it. We're not shying away from confronting it. And I think that with what we have put together, we can only continue to progress in the direction of solutions to the problem.
But are we progressing fast enough so that we don't have many deaths on our hands? I mean, there's a story I have here of a woman. They were doing an operation. They were using a genset. They were doing an operation. Light went off. And they were now using genset. Before they could go to put the genset on, the child got a brain palsy and died from there. I mean, that's a sad story.
It's very, very sad indeed. Of course, these are stories that we still see in some part of our country. Private practitioners were at the dialogue yesterday, and some of them recounted their experiences. In fact, the national president of the Association of Private Medical Practitioners said that anytime he wants to do surgery in his hospital, he's afraid that light, electricity will go off and will become an issue. And that each time that he has a surgical case to attend to, he would prefer to go on generator.
Yep.
But that despite that, he's afraid because the generator sometimes can malfunction in the middle of the procedure. So it's a reality that we are confronted with. There's no doubt about that. But my assurance that I can give to Nigeria is that we recognize this problem. We have accurately diagnosed it, and we're providing solutions to it. It's not going to happen overnight. Let's not deceive ourselves. We're not going to move from that where we are now, and overnight we now see that all our hospitals are light up. It's not going to happen.
Because, for example, today in my house, I was so pissed. I think NEPA took, I'm calling it NEPA, PHCN took, I don't know what they were doing, really, about 4 or 5 times, and I was working. I mean, it was just so annoying. Not to talk about hospitals when you have to treat people. Now, let's talk about the FCT resident doctors have called on the administration to declare state of emergency on 14 district and general hospitals here in the FCT, adding that the 7-day warning strike will be uninterrupted. I think that's supposed to end on Monday. But the NAD, National Association of Resident Doctors, says it's commencing its strike tomorrow, Friday, by 8 a.m. to end 16th. Apparently, your meeting with them on Monday fell through. What next?
First, on the FCT resident doctors, were engaging the FCT authorities. They are their employers, and we encourage that dialogue to continue so that some of those things that they're asking for can be addressed. With NAD, National Association of Resident Doctors, my strong conviction is that there will be no strike because the nucleus of what they're asking for is the payment of
Payment, allowances, overwork doctors. I interviewed Charles Ebong, the president here, the other day. Doctors are taking too many things, and then allowances, the psychology of it. It was 8 months they haven't been paid, and you're wondering how are doctors not being paid for 8 months on the bounce?
Well, to be honest with you, I'm not able to answer for the FCT authorities. But with respect to National Association of Resident Doctors, those who are employers of the federal government of Nigeria, the Federal Ministry of Health, I can tell you that we're not owing them 8 months' salary. What is really the contention is the payment of what is called medical, MRTF, Medical Resident Training Fund. Government provides some grants to resident doctors to be able to do exams. And for the 2025 granting, we have paid 60% of it, about 60% of it, an outstanding of 40%, which, as I am talking to you, has landed in the IPPIS account. That is the account where it will go to the account of the doctors. And that's why I say that I believe very strongly that there will be no strike.
No, they said that. Unless you're going to meet with them again.
No,
because they said they're starting tomorrow.
What they need is the alert in their account. I have received the communique that they have issued. What they want is the money in their account.
Okay.
And so if they have the money in their account, I expect them to quickly be able to say, okay, government. Yes, there are other demands that they are making. Some of those demands are also being addressed. As I'm talking to you, we have an ongoing collective bargaining agreement meetings with all the various health workers, doctors, nurses, and other health workers. We're meeting with them. This evening we had a meeting, and so on and so forth. So that collective bargaining mechanism is also to address some of those major issues that cannot be immediately plucked, But on this MRTF stuff, is something that...
so can you tell them while two of us are talking, I mean, they're listening, they're watching you,
yes,
that probably by this evening they should get the alert?
That's my belief, because I know that as at...
Because alert works wonders.
Yes, as at early this evening, the money that they need has been released from the Ministry of Finance.
Yeah.
And it has entered into the IPPIS account, where it can now be disbursed to the various accounts. So that's what I can tell them.
All right. There's this private medical practitioners entered into partnership with the Nigerian Electricity Regulatory Commission, that's the NERC. But the report is that the collaboration is yet to deliver the desired result. I don't know whether you can talk about that. Why?
I do not have full information about this partnership. Maybe I need to find out. And if I feel that something that is too strong in getting my comment on, then I can get back to you on it. I do not have full information around that.
What about special tariffs for hospitals, anything like that?
Special tariffs in terms of power?
Power, yes, of course.
Well, you know that this is something that we have tried that has really not worked. The discos are business people. I do not believe that that is really a sustainable way to go.
Okay.
Maybe in a very short term, we may be able to do that. But if we're looking at sustainable, long-lasting solutions, tariffs and differential pricing for the health may not work, because discos, they will take their energy to where people can pay, and that is the mentality of business, So we do not believe that's a long-term approach to
solving
this
particular problem. Because I mean, a former president of the Association of National Accountants of Nigeria, Dr. Simon Zaka, wondered. He said the government had not given the power sector the required attention with respect to tackling concerns associated with electricity generation, transmission, and distribution, which is what we're discussing now.
No, but the truth of the matter is that in the last 2 years, transformational changes, or the groundwork for transformational changes in the electricity sector is being laid. The Electricity Act, for example, which unbundled and democratized the electricity space, it's a very major decision of this government. And that is why you can have states now creating energy boards, now appointing commissioners for power and energy. This is why you can now have mini grids, you can have IPP springing up, and you see that a lot of manufacturing facilities are able to also connect with IPPs to do their job. So that is a very, very transformational groundwork, and which we are building. But for that, this dialogue that we had, we could not have had it, because you would not be talking about mini grids if there is still that monopoly.
Yeah.
Now the monopoly has been broken. And you know, when the monopoly was broken in telecommunication, you know what happened. So we are in that direction of solving that problem. We are heading in that direction. We are persuaded that we are headed in the right direction.
One hopes so, because the big elephant in the room for some people is the attitude of government to health. Experts are saying that government has not really taken the health of the people as the most critical, and the health of a nation is the health of its people. We'll leave it there. Minister of State for Health and Social Welfare, Dr. Iziaq Salako, thank you for spending time with me here on Prime Time.
Thank you very much for having me.